Okay. We will get things started here. Thanks everybody for joining. Really appreciate you taking the time. We have a really cool conversation to set off today. And as part of our APDT International Partner Spotlight, we do these from time to time, but in an attempt to make everyone aware of the things that you already have available to you by being a part of APDT. And this is one that we are very, very excited about. This is a new offering. It's a member benefit and a partnership with EZAccessMD that's just come online, but thinking about this as a long-standing challenge and a number of challenges and issues that business owners and just people in general experience day to day, especially around taking care of yourself. It's one of the most important things you can do for not just for yourself, but for the people around you and the people that you're caring for in your business. And so, with these partner spotlights, we're in the business of problem solving. And so, as we identify something that is common or a trend or a challenge that we know a lot of our community are facing, we set out in trying to partner with people or identify resources to help solve that problem and make that a part of this whole package and things that are available to the community. So that's what we're looking to do. So great conversation today. I've got some friends here on the line that we'll be touching in with as we start to dive deeper into this opportunity. But just kind of setting the stage, what is the problem that we are setting or that we are attempting to solve for? You're a business owner. You're a person. You're a human being. You're in a family. That so many different roles. Your resources are critical, but you're caring for your clients. You're caring for your family. You're caring for your team if you have employees or other people you work with, or you have partners that you're working with, and so forth. Taking care of your expenses, budgeting, paying the bills, all that fun stuff, making sure all the trains run on time, the scheduling and networking, and making sure that everything fits into the amount of time that we all have on the planet. What's missing from this list? You've heard the conversation as you get onto a plane. Make sure you put your own oxygen mask on first before helping someone else, and that's because if you can't breathe, you can't reach over and help somebody else out. So that's very much in this mindset of wellness and taking care of yourself, critically important as a business owner. To be able to care for those people you see on the left on that list is taking care of yourself first. So all of this spins into an opportunity that especially entrepreneurs in the US and a number of different places really struggle with is access and affordability and a number of different things when it comes to healthcare and trying to balance all of the care and the needs that you have for all the people that you do care about on the side there. So that's something that we're going to talk about today. It's critically important that you take care of yourself as you try and take care of everyone else. And we want to make that much more possible. So that's really where this partnership was born from. Small business owner challenges, of course, dog trainers, especially, is the group that we're talking about. But small business owners challenges across the board. Very not exclusive to dog trainers, of course, but these are very, very common and something that we wanted to address because we hear about it for so many times. Access to health insurance benefits. 1 in 4 self-employed Americans have no health insurance. I've been a self-employed American. I had no health insurance. I've been in these places before, and I know, to do this on your own, incredibly expensive and time consuming. And when you do finally find the one that fits and checks all the boxes, does it really give you the care that you need? And so that is always a question coming at small business owners. No time for doctor's visits. How many people are running their own business 24/7? How many people are the business that if you have a typical doctor's visit, which takes 121 minutes, according to statistics, that's 2 hours out of your day that to take care of something very critical, and that's taking care of your own health before you take care of other people, as we just talked about. But that's 2 hours that you're not able to support your clients. That's 2 hours you're not able to do all those other things that are critical needs. And healthcare affordability not going down anytime soon, unfortunately, here in the States. Out-of-pocket costs for a single ER visit can average $1,082 without hospital admission. That's just to go to the doctor. And of course, with varying degrees of insurance and coverage and in network and out network, and all of these things can can really spin into variables that drive those costs up. And unfortunately, each year we see the cost of that increasing, and that's something that I know each of us feel this. But this is something that we are very excited about, this partnership and this opportunity, because it's not just in substitute of health insurance. If you have health care, there's still these costs, there's still these copays, there's still the cost of engaging with telehealth services through your insurance and things like that. I have that in my own experience too. And so if you're thinking that you already have health insurance, that you don't need any additional services that this might offer, just hang on while we walk through this, because this is something that I think you're going to be very, very interested in. And then, of course, providing healthcare to your family, critically important. If you've got a spouse, you've got a partner, you've got kids. Unfortunately, we can't put our dogs on health insurance yet. But, of course, there's the cost of providing healthcare to your family. Each individual in your household, that increases that cost of managing just basic healthcare. That's just normal stuff, doctor visits. It's on $24,000 a year on average. And so that's to provide to an average family size in the United States. So all of this tremendous cost for healthcare, just going to the doctor, the time that it takes, and even having access to insurance benefits are risky, especially to small business owners. Inez McNeil, who is on the line with us here, is all of these things. She's a member, she's a small business owner, she's a mother, she's a board member, and she is an Easy Access MD user. And so I wanted to hand this over to Inez because Inez has some very real first-person experience in partnering with Easy Access to support some of the challenges that we've just talked about. So Inez, please tell us about your experience with Easy Access, and how are some of the things that we've just talked about as a business owner, how have those affected you?
Yeah, no, absolutely. I'm excited to dive in. I'm very, very passionate about this topic. Just to back up a little bit, I have over 15, probably almost 20 years of experience in the dog training industry at this point. I'm a certified professional dog trainer, and I am the 2025 APDT chair. So, as part of my role here and kind of giving back to the industry and doing my best to really help provide for the people in this industry as best as I can, um, and to further support and establish my passion for helping talented dog trainers succeed in business and in life. I was really thinking about what the impact I wanted to have was as part of my role here as chair this year. And it really boiled down to eliminating barriers that really prevent people from being able to make dog training either their full-time income or situations, especially healthcare costs that really add hardship to entrepreneurs when it's really their only income, right? I am a mom, I'm a wife, I've been the breadwinner of my household. And, as a mom of a 5-year-old, and I've had my own just spontaneous health crisis here and there, I understand that the healthcare costs can really add up. And so when I came across Easy Access MD, I was shocked. I was like, this is too good to be true. But it isn't, it is true. And so I'm really excited to bring this as a new member benefit to the APDT in 2025. And I hope that a lot of people take advantage of it because you really can't find it anywhere else. So let's think about like kind of what typically happens when you or someone in your home gets sick, right? Usually, if you're lucky enough to have some sort of access to a teledoc service, I know it used to be free during COVID, but now it's, $50, $100, $150 per teledoc visit. And that's probably the same or more if you actually spend time and go into a doctor's office. Let's say even if you have insurance, right? Those costs really still add up. Those are still there. Those are costs that you're paying in addition to your insurance premium. So it's very expensive here in the United States. On top of that, if you have to take time out of your day to go to a doctor's office, you're probably having to cancel your plans. You're rescheduling hundreds of dollars worth of work that you could have completed. And that's obviously very costly to the business, but also to yourself, especially if you have dog training as your full-time income. Um, you know, ultimately, when you go into those doctor's offices or you do that teledoc appointment and you've paid $50 to $100 for that appointment, you don't even know if you're going to walk out with a diagnosis, right? You don't know if you're going to walk out with a solution or a prescription, or you may have to go back in for more testing and more things like that that are only going to have to make you cancel more plans, and in addition, also having to pay more copays for additional visits. So it's really costly to do all of those things. Again, in addition to your already expensive insurance premiums, which I know can be very expensive when it's just when you're paying it out of pocket as an entrepreneur. So what happens with EZAccessMD is basically it's a one time per month subscription cost, very low cost. You get a call. This is from personal experience. You get a call, you call in, they call you back within 5 to 15 minutes with the doctor on the line. And then you get to understand kind of what your maybe diagnosis is. You get to understand what maybe additional testing you need. And there's no additional out-of-pocket cost for that. You can call in as many times during the month for that one fee, and get, prescriptions filled very, very quickly. So it's very easy to get access to a doctor, hence their name. So I really am excited to bring this to the APDT. Just speaking from personal experience, one of the situations that comes up for me is when my daughter had strep, and we would have had to, I had meetings that I really could not reschedule. And so I called Easy Access MD. They called me back. They sent out a person with a test, like a nurse with the strep test, to my home and gave her a strep test right here. So we didn't have to travel. I didn't have to put a sick kid in the car and drive 30 minutes to the doctor to wait in the waiting room. She got to just be comfortable on the couch until the strep test came by. And we were able to get, the diagnosis for that. And then, we subscribed to the Walmart prescription delivery. So we actually even had the prescription for their antibiotics delivered to the house. So we got the healthcare we needed and the medicine that we needed all without having to leave the house or disrupt our entire day. So other than having a sick kid at home. So I think that really showcases the convenience and the amazing service that Easy Access MD provides. Again, for just one low cost subscription fee once a month, you can call them and have them come out as many times as you need to be able to get your prescriptions filled or get your diagnosis as quickly as possible. So it's amazing. I'm really excited that this is going to be available to entrepreneurs and dog trainers across the country as part of our membership. And I'm going to hand it over to the experts to really talk about their service and share what all they can give us.
Yeah, very cool. Thank you, Inez, and thank you for your experience. You're sharing that experience in there. We will hand it over to the professionals. We've got Tim and we've got Brooks on the line here from Easy Access MD to talk us about. Because I know you're all very eager. If you're watching along here, you're clicking around and you're trying to figure out how do I do this. I want to just get to the point. Let's get through and click through. I want to sign up right now because why wouldn't I? But Tim, Brooks, you want to talk a little bit about how does this work, and how can people who are watching this or learning about this maybe for the first time, how can they engage with Easy Access as members and start working towards the great things and sharing the experience that Inez is?
Hey, Tim, I think you're on mute.
Hi, everybody. Tim Randall here with Easy Access MD, and we're really excited about this partnership with APDT. Easy Access MD has been around for about 8 years, providing this service across the country, and we'll get into a little bit more detail about what that looks like in just a minute. But this is kind of our a big step into the association space. But Easy Access MD really we exist to remove those barriers that Matt and Ines were talking about that happen with healthcare. A lot of it is time and money that it costs you. So we've traditionally have worked with employers that provide this as a benefit to their employees. This is a little bit different, but we've had some great collaboration with your leadership here at APDT to make this a great resource for the members of APDT. So what I'd like to do here today is just kind of fill in some of the things that, and as it talked about with her personal experience, but just to help you to understand what the service is going to look like for you as a subscriber to the service. And then at the end, we'll have some questions, question and answer as well. So feel free to chime in at the end and we can answer some questions that aren't covered during the slides. So you're probably asking, what is EZAccessMD? We are a very unique telemedicine company. So we have board certified physicians that are available to our subscribers, and their family members are included as well. And you get 24/7, 365 access to a board certified physician. We don't have nurse practitioners or PAs, and not that there's anything wrong with those folks. They do a great job, but I think most people would prefer to talk to a doctor if they can. So, so that's who you'll be talking to when you call in for a consult. And with your subscription, like Ines said, you've got unlimited access to this. So, and then in certain locations, what really makes us different is that, like where Inez lives, for instance, we can bring different diagnostic tests that you might have to go to a doctor's office or urgent care or the emergency room to have done. So in certain states, we're able to do more of these diagnostic tests in addition to the telemedicine. So what that allows us to accomplish is where we have these mobile services available, especially is we can do about 85% of what an urgent care center can do without ever having to leave the home. And you've got unlimited use with your subscription, and it just leads to better outcomes, helps you to, to be an effective business owner, to be attending to your business, but not, dropping through the cracks with the needs that you or your family have with healthcare needs. And next slide. I like this slide because this just shows really side by side traditional telemedicine versus what EZAccessMD brings to the equation. And you can see that where we have diagnostic testing available, pretty comprehensive. Again, it's about 85% of what an urgent care center can do without ever having to leave the house. So next, just wanted to talk about, you're probably asking like, what, when would I call? This is a kind of a bullet point list, but I like to try to make this even easier for you to remember. So as a subscriber, if you're looking to access healthcare because you or one of your family members are not feeling well, or maybe you've injured yourself, and you're considering going to your doctor or going to the urgent care center or the emergency room, call us first. You have that subscription, you have unlimited use to this. So with that mindset, just call us first. And if our doctors are not able to help what it is that you're calling about, you now have a doctor that's going to say, listen, this is maybe something more serious, or this is beyond the scope of my practice. You should go here. So now you have, good medical direction from a board certified physician. But that being said, most of the time, over 98% of the time, we're able to resolve most things that people are calling for. So next slide, please. So now I just want to walk you through the patient experience. And what's really great about this is that once you've gone through the enrollment process at APDT, you don't have to set up an account. You're already going to be in our system. Your service will become effective on the first of the following month when you register, and want to walk you through that experience. So all you need to do when one of your family members need help is call the 1-800 number. You'll speak to one of our care coordinators, and they're going to ask you who's your employer, or in this case, what association do you belong to? So just make sure that you mention that you are a member of APDT, and they should have no problem finding you in the system. They'll also ask for your name and date of birth, and they'll also probably verify your address in case mobile services are ordered by the doctor if they're available in your area, and we'll also verify your phone number because, as Ines said, within 15 to 30 minutes, a doctor will be calling you back to do a deeper triage of what it is that you're calling about. And then in states where we have, if the doctor needs more information, they can order these different diagnostic tests. In that suitcase is different lab tests that we can do, and also some devices that we can use to give that doctor more information than they would have over the phone or a video. And You can see here in certain states, we can actually, take some images of inside someone's ear or down their throat to get more clinical information for the doctor to make a more accurate diagnosis. And we can also even do things like X-rays. And X-rays, we can bring those right to the house, and uh, many people associate them with, just for things like extremity injuries, like you see here, but they actually are even more useful for if people have an upper respiratory illness, for instance. They can confirm or rule out pneumonia, which can be very dangerous, but also can be diagnosed with an X-ray and treated very safely at home. So imagine if you went to the hospital with such a condition, you may even get admitted, and that's a very costly thing from your perspective, for something that probably could be treated at home. So just giving you an example of how useful an X-ray can be. And then all the diagnostic tests that our doctors order are rapid result in nature. So we're not sending them out to a lab and calling you back in a few days. The idea here is let's get these rapid tests evaluated right away. And ideally, we're going to call you back that same day with the results of your test, your diagnosis, a care plan, and then we're also going to write any prescriptions that you might need based on why you're calling. So that's the patient experience. So as far as the different plans that are available, so we have, we have two different options. Actually, they're not options, but based on where you live, you're going to have either telehealth and the mobile plan available to you. That's where we can do the diagnostics that we bring right to the house. And the cost of that, as a subscriber and as a member of APDT, if you just scroll to the next animation, Matt, that would be great. It's for this service, it's $22 per month. And again, there are no copays or deductibles or additional fees, and you can use this as much as you need to. So you've got 24/7, 365 access to a board certified physician. And under this plan, you'd have availability of these different diagnostic services. All the diagnostics that we do are ordered by the doctor. So you wouldn't be able to call up and say, hey, I need an X-ray, and we send an X-ray out. Like, a doctor would have to talk to you first, and they would order that X-ray. So another important thing too, so this is not just for you as the member of APDT, but it also extends to your family members. So your spouse and your dependents ages 2 to 26 can also use this service, which is great. And the reason why we include these people is because we know, whether you're an employee at an employer or you're an association member like yourselves, if your kids get sick, like, and that's with her example, if your kids are ill, they need you to kind of do something, take them somewhere and deal with that situation. So by being able to take care of them, it just provides that convenience for everybody, and just helps you to be a more effective business owner. So the benefits of this plan, obviously you're going to be saving a lot of time and money, because we're going to bring all these testing things to you, and providing a lot of service without ever having to leave the home, under this very affordable monthly subscription that you would subscribe to. And then for those of you that are in areas where we don't have mobile services available, we have a telehealth plan. And this is obviously going to be priced a little bit differently than the mobile service plan, but that's going to be $7 per month. Again, no copays, deductibles, additional fees. You can use this as much as you need to. You'll still have unlimited access to a board certified physician that's available 24/7, 365. And your family is also included, so very similar to the other plan. And you are still going to save time and money by not having to go to a brick and mortar facility. So as far as what's available in your area, so you would have received an email if you're a current if you're currently a member of APDT, you would have gotten an email back on March 20th to kind of introduce this program, and it has information that would allow you to be able to register for the service. So there are links in that email that you received, and if you can't find that email, or maybe you're watching this in the future and you're just joining APDT and you want to find out more about EZAccessMD, you can also click on this link and just search by your zip code, and then it will tell you which option is available in your area. So you can also scan on this QR code. It'll take you to this link where you can check by zip code what's available in your area, and you'll also be able to click to register for the service that's available in your area. So that's how you can find out what's available in your area. And we are always expanding our footprint. So if you are in a telehealth area right now, there's a good chance that at some point in the future, we may actually be providing more comprehensive services in your area. But our telehealth is amazing. It doesn't cost you anything, no accounts to set up. So even if you have health insurance and you have a telehealth provider that's part of your plan, you may have some costs associated with that. You don't even have to use it. You can use this instead and have unlimited use. And then finally, so this is one more opportunity to take a look at the zip code search tool, and you can click on this QR code. It'll take you right to the site to check that out. And again, you'd be able to register from that zip code search tool. It'll take you back over to the registration portal over at APDT. So
I'll put that link in the chat just so everybody can access it a little bit easier too.
thanks,
Thanks, Brooks.
But that's it in a nutshell. Again, we're really excited about this opportunity to take care of the folks here at APDT so that you can be more effective in running your business and growing your business and doing what you're passionate about. So thank you.
Hey, cool. Thanks so much, Tim and Brooks. Appreciate you joining us and talking through what's available to APDT members. And if there's anybody who's taking a look at this that's not a member yet, this could be available to you. And so that's something of interest to you. If you're thinking, wow, I've always thought about being an APDT member, but this really kicks me over that side of the fence. I'm ready to sign up right now, become a member, and then this offer will be available to you. I think, Tim, the thing that really stands out to me, and the point that you made, I think a couple times there, I have insurance, and I feel like it's good insurance, but when I go to to have a telehealth appointment, maybe I can't travel, I'm not feeling good, don't want to go sit in a doctor's office. I know my insurance charges me like $60 to do one visit. And I think that point you made about this being unlimited for a really low monthly fee, significantly different than my experience with telehealth. So that is fantastic.
Yeah.
Appreciate you sharing that.
Yeah.
We do want to open it up for questions. If you are on the line here and you have if you have any questions about what we've talked about here today, or anything that we maybe haven't covered here, feel free to drop those in the chat, and we can answer those questions as they come through, and we'll be looking at
In the meantime, I have a
Mhm.
question.
Yeah.
Sure.
I know we talked a lot about visits to the home, but I do also know they can go to your place of business. So Tim, can you kind of clarify, like, where can these diagnostics visits occur?
Yeah. Yeah, if your place of employment is within our service area, you would just need to specify that, hey, I'm not at home. I'm at my business. This is the address. So you'd have to specify that. Otherwise, we're just going to kind of default to the address that's on file. So yeah, so I would just specify that when you're speaking with the care coordinator
Yeah.
and with the doctor.
Yeah. No, that's awesome, because I know a lot of people, especially business owners that have a facility, they don't have the luxury of staying at home even if they are sick.
Right.
So
Yeah.
having somebody come to their facility to be able to get the diagnosis and get them on their way to being healthy would be really great.
So while we're waiting for any questions that might come up, I'll just maybe mention a couple that are common that I see a lot. And one of them is always like, how long does it take for that mobile service to show up? And we like to say within a few hours of you speaking with the doctor, that test will be brought out to your home and communicated back to the doctor. Again, because we're bringing this physically to someone's home, it's not like a piece of software that goes anywhere at any time of day. Usually those tests are going to be delivered, within kind of like normal business hours. In some states, maybe it extends a little bit further into the evening. But if we can't get there that day, like say you called at 8 o'clock at night, we would make arrangements to have that test brought out to you like the following morning. So there's a lot of communication that would happen between the person that's coming out to bring the test and with you. but we like to try to get this all done in one day, and in general, on average, within like 2 to 3 hours, we're able to bring that test out to you. So that's a common question that comes up.
That's great. That's great, Tim. About the timing of that, especially. And I know in my experience with telehealth calls, even without someone coming to my home, my experience has been a lot of these things that people may call for can be solved over that telehealth option, and even without needing someone to come to the house to do, unless there's a test that's absolutely needed. Like there's a lot that can be solved over the telehealth and the telemedicine style of doing things, and I think that's something that we've talked about in your experience as well, Tim. Do you find that to be the case, in Easy Access's experience across the country? A lot of calls are normally, or at least majority of them, are resolved over the phone.
Yeah, a lot of them are resolved over the phone because everything does start with a telehealth consult. So, like I said earlier, you wouldn't be able to call up and say, "Hey, I need an X-ray," or "My child needs an X-ray." Like they would have to be triaged by the doctor, and they would order that test. But they are able to resolve quite a bit of these, initial consults over the phone, um, without having to do any sort of diagnostic test. But that is really what makes this different than other telehealth providers, where, you may sound like you have strep, but the only way to really know if you have strep throat is to do a test. And
Right. Yeah.
other telehealth services, whether it's part of your insurance plan or what have you, they don't have the ability to do that. They may
Mhm.
still prescribe medication, which maybe is not a good thing either if they don't know for sure that you have strep throat. But at the very least, what they'd have to do is say, hang up the phone and go to urgent care or make an appointment with your doctor or what have you. So, it removes that convenience. And then now you're looking at a whole new set of costs to get these different things done. Just
Yeah.
walking into an urgent care center, um, is a costly proposition. So just being able to avoid that, it just puts that money back in your pocket, and it gets that time back on your calendar.
Yeah, yeah, absolutely. We do have a question in the Q&A. If I can pitch this over to you, Tim or
Yeah.
Brooks. The question is, what if I have an already diagnosed condition, diverticulosis? So there's possibility of flare-ups. I don't have insurance, so a visit to the ER or immediate care is expensive to see if it's an infection or just an inflammation.
Mhm.
Is that something that this person could do with the mobile service or telehealth service?
Yeah.
As a blood, I don't know if a blood test could be done to determine the WBC in this question here, but does that
Yeah.
sound like a situation that Easy Access MD could service?
Yeah, so I'm not a physician, so I wouldn't be able to say that for sure. But you have a doctor that's going to, tell you what they can, or they're not going to try to do more than what they can do within the scope of their practice and within that particular setting. So
Mhm.
if they can't take care of it, they're going to, recommend what you should do. Um, like for instance, like we're not going to, like if you're having chest pain and it's radiating down your left arm and you're sweating and you got shortness of breath, they're not going to try to, send someone out to do an EKG. They're probably going to say, you should hang up the phone and go to the emergency room or call an ambulance, that type of thing.
Yeah.
So, yes, it's really going to depend on the doctor's judgment call, but they're not going to try to do something that's out beyond their scope of practice. But you have a doctor that's going to give you good direction of what you should do next.
Yeah, yeah, and then like you were saying, especially with this um, subscription fee and the access to calling first,
Mhm.
to kind of triage that or talk that through with a
Yeah,
doctor before you go to the ER and encourage or incur the large expense to find out that it wasn't what you thought it was, or it
right.
wasn't, something like those. You are communicating with a board licensed doctor, from your area
Yeah,
that can really talk that through with you, without any additional cost to that. So even the consultation in
right.
most situations would have some degree of a visit charge, and definitely going to the ER to be evaluated for those things, to sort of things. One thing I know that in using telemedicine in times past, we get to a certain age, we know things about ourselves, especially if it's someone who has like an existing condition or things like that. You're like, I've had this happen several times, and I know this feels like, I know times when I've engaged with telemedicine of like, I've got an ear infection, I've had lots of these, I know what this feels like, and so that conversation and that evaluation has always been really resourceful for me, especially the idea of being able to reach out anytime you have that feeling, and not really helping to decide what is your next course of action with a physician.
Yeah.
Hugely valuable,
Yeah.
and super excited about that. Yeah.
Yeah. It's a great question. I appreciate that.
Yeah.
Another one that comes up a lot is that maybe somebody already has insurance through their employer or through the marketplace, and it has a telehealth option. Why would I want to use this? And I think we did cover this a little bit,
Yeah.
and that this isn't going to cost you anything beyond that subscription that you would have. So there's no fee for radiology if we come and do an X-ray, or if it's just a telehealth visit. There's no additional fees that happen beyond that subscription that you pay. So it's
Mhm.
it's a pretty cool
Mhm.
thing. And so even if you have some of these things available to you, there's going to be that cost and time that's going to be avoided by using Easy Access MD instead.
Yeah. No, that's a great point, Tim. And I think you raised something for me that I thought we might comment on as well. The process of members subscribing to this, it's 3 months at a time. So it's not like you're into this lengthy contract. There's a good opportunity for people to really dive into this at a low entry rate, low cost, to start out, and sample it themselves and really try it out, without a lengthy commitment. If it's something that doesn't work with a person's individual environment or their situation specifically, you're not locked into something that you can only opt in or opt out of most insurance programs like once a year, and this is
Right.
definitely not a situation that resembles that. But that idea of being able to sample this and jump in and explore it, from a person's perspective, very much part of this, and that's super exciting too. And our hope is, and our belief really is, and you jump in and try this out for a little bit. It's not something you're going to give up very quickly, because it's just always there for you. It's a great resource to have. So encouraging everybody to, if you're watching this and you're learning more about this, there is an opportunity to just jump into this, explore it, relatively low cost to get started, and tremendous value and benefit on the back end of that, but really an opportunity to explore it. Everybody's situation is different, everybody's environment is different, and their needs are different. And so, if you're thinking about it, you think this might be good, I think it's something that people can try out, even without feeling too locked into something. And I do think it's going to be hugely valuable for those that do that.
Yeah.
Yeah, just to kind of break down the costs, like I think of it as, that 3 month subscription, whether you have that $7 a month subscription or the $22 a month subscription, 3 months of that is still lower cost than probably one teledoc appointment,
Yeah.
with the way things are these days. So, yeah, so it's an incredible opportunity for all
And
these
certainly a lot less than
incredible
an urgent
trainers.
care visit.
Oh,
Yeah, yeah,
definitely.
for
Yeah.
sure.
Yeah.
And lower than a lot of just individual doctor visit copays
Yeah.
with
Yes.
insurance. Like copays are going up, and the out-of-pocket expense, even with insurance, is
Yeah.
going up. So the cost of these subscriptions significantly lower than even one doctor's visit in a traditional sense. So yeah, lots of opportunities here. Absolutely.
Yeah. Yeah. One other question that might resonate with the audience. We have had some inquiries from other members of APDT that have employees, for instance, and asking about, how can I sign my employees up for this? And something that we are working on. It's not something that's available right now. This subscription is only available right now to people who are members of APDT. So your employees may or may not be. If they are, then they could subscribe, obviously, as a member. But we are, working on a path forward to logistically make this work for people to extend this to their employees if they're not already members of APDT. So those that came up 2 or 3 times since this was launched. So other people might be wondering that as well. So
Yeah.
once we get that figured out, if we can get it figured out, you'll be the first to know.
Absolutely. And I think, the opportunity for members to dive into this and experience this themselves with their family and their spouse, their partner, that perspective, having gone through it yourself, you're really going to know what this could mean to your team as we get down the road in these next phases of this and be able to expand this. So your own perspective, your own experience with this as a member, I think is only going to add to your ability to provide for your team, when that becomes a possibility. Absolutely. Absolutely. Great. I was just checking the Q&A and see if we had any more questions pop up. I don't see anything in there or in the chat. Just want to throw it out to anybody who's on the line with us. Any last questions as we're wrapping things up here, or any curiosities about how to sign up, where to sign up?
Matt, I don't know if you want to pull back up that slide with the registration link. That would maybe be helpful, or at least the QR code. And then people can take it from there. But yeah, I think this is so exciting to be able to give to all the incredible business owners in the industry, and hopefully all their future employees as well, as everybody grows.
Yep.
There it is.
Again, this QR code will take you to the zip code lookup tool, and it'll tell you what plan is available in your area. And it'll also give you an opportunity to go back to register over at the APDT member portal. I think it also has a link in there to a frequently asked question page that may answer some other questions that you might have as well. So very useful.
Absolutely. Now, we tried to make it as as simple as possible to sign up for this. So as Tim mentioned, these links will take you right to the information pages. You'll be able to click through to sign up for the service that you're eligible based on your location. And that takes you right to a checkout page, which links you right to the ability to put your information in there. So making it really easy to sign up and the steps to do that. And then, of course, we're here to help. Should you have any challenges going through that process, just feel free to reach out. And yeah, we look forward to supporting more members with great partnerships like this with EZAccessMD. But very, very excited about something around healthcare in such a need across business owners, across our membership, across our community. It's tough out there in the healthcare space. I really appreciate the innovation and the thought that's gone into this process and working with you, Tim Brooks, into bringing this to our members. This is going to be such a cool opportunity, such a great value add to our members, and super excited to partner with you on this.
And likewise, thank you.
Yeah.
Awesome. Thank you guys so
Thanks,
much.
guys.
Yeah,
You're welcome.
thank you. Thanks everyone for joining. If you're watching this later, of course, if you have any questions or if there's anything we can help with, feel free to reach out. But we're so excited. Thank you so much for being connected to APDT, and we'll look forward to seeing you next time.
Welcome. Thank you.
Take care.